Thank you, everybody, and I hope everybody had a great Memorial Day weekend. I hope in your own way that you made sure that we honored. I'm going to take the mask off. I do have the mask. That we honored our veterans properly, for it was their ultimate sacrifice that allowed us to lead the lives we lead, whether good or bad. Before I go into update remarks, we are in desperate need. And again, the business community and the private sector community have been fantastic with donations. Thermo-infrared thermometers. Again, thermo-infrared thermometers. We are in desperate need of them here for the city. I've been able to obtain some through donations, and some we're still awaiting on order, but if you can do that, that would be greatly and deeply appreciative from there. We're going to change the pattern a little bit today. Dr. Robert Roos, who's the Chief Medical Officer of Mercy Trinity Healthcare, is here. He's going to have to leave a little earlier, and Dr. Mark Kerouac, who's the President and CEO of Bay State Health Systems, is unable to be here. He had to cover another meeting and event. But we're very lucky to have Nancy Schendel-Valick here, who is the President of Bay State Medical Center and Senior Vice President of all of operations. So what I will do is I'll give a brief little update that I'm so appreciative. We've had a great partnership with Bay State and with Mercy on all endeavors in our communication, especially with the homeless testing. So after I give my update, I will bring them up to give their updates, and subsequently, right after their updates, I will allow the press to ask any and all questions of Nancy and Dr. Roos, because they have to leave, and then we'll go back into my cabinet heads update. It is great to have the lovely young ladies, the trifecta I call them, here for our sign language, and I deeply appreciate that they're here. Let me give you a quick rundown. We're starting to see a bit of a decent or a good trend in our numbers. Friday we finished up, there was 43 new cases, Saturday 28, Sunday 21, Monday 27. So over the long weekend we had a total of 119, which gets us to a complete total of 2,261. Commissioner Helen Carlton Harris will go into it a little more specific, but you'll see in our bar graphs that Billy Baker, my communication director, posts every day. You start to see a trend, which is good, decent, good trend. AG Maura Healy had reached out to me Thursday evening, Friday morning we spoke. She wanted to know of any needs that we might have here in the city of Springfield as our continued attack to defeat COVID-19 coronavirus. And I spoke with another good friend, Governor Baker, Saturday evening for a check-in update. Again, Memorial Day events, we held our event here at City Hall. We'll always remember and never forget, and we were very honored to have Chairman Neal, Congressman Neal Ritchie here for that event. As you know, Thursday, and I appreciate the media, the print, radio and TV media, you've been great getting out information and communication, which is key. The City Hall reopening aspects, we detailed it. Thursday, you might have some questions that my cabinet heads can answer, but that technically, we're doing a test run today, technically starts tomorrow with City Hall reopening, appointment basis, and all the protective aspects that we're doing, not only for our residents and business community, but to preserve and protect our city employees. Helen will get a little more into it, but we told you we were going to give you a little bit of a breakdown. One death is too much, too many. 92 deaths of Springfield residents have been incurred. This dates back as of May 20th. Of that, 48 long-term care facilities, which breaks down to about 52.2%, 44 residential, 47.8%. Helen said she would get us, and she got us the ethnic breakdown. Caucasian or white, 46, which is a split, 50%. African American Black is 19, which is 20.6%. Hispanic is 26, which is 28.2%. Asian is 1, which is 0.01%. And God rest all their souls, and my thoughts and prayers and sympathy go out to their family and loved ones. Homeless, and I'm very pleased. We've been able to stay on top of this. We moved immediately with my city team to put together the medical triage tenting, which I feel which has paid dividends, and the partnership with Bay State and Mercy has been fantastic. They've also expanded their testing tremendously for the average person, whether our neighborhood centers in Brightwood, Plainfield Street, North End, standing up at Mason Square, Carew Street, High Street, Mercy. So overall, we've tested 187 of the homeless population. Only nine were positive, which breaks down to a 4.8%. Financially, as I have done with past natural and man-made disasters, we will not skimp a dime when it comes to being able to put forth for our residents and business community, and I'll go after every dime I get my hands on in reimbursement, especially from the federal level and FEMA. And we have the same consultant that we used during the tornado, the freak nor'easter, the gas explosion, and now this pandemic. So we've deficit spend $5.5 million. We've had a revenue loss of $3.5 million, and every cabinet head is tracking it down to a T, and I appreciate my CAFO, TJ Plant, and Financial Division staying on top of that. We received another donation, G-Tech, Commissioner Clapprood. G-Tech is doing the body-worn cameras, which we're moving forward on. They donated 400 masks, surgical masks, to the Springfield Police Department. Commissioner Clapprood will, when she speaks after our medical update, they're down 6. We had a very manageable weekend, knock on wood. Why? Because of the strategic proactive patrols that Commissioner Clapprood put out there in working with our dedicated and brave men and women in blue, State Police, and Sheriff Nick Kochi, the Sheriff's Department with our parks. Commissioner Calvi will speak. He's down 3. They had a couple of fires. They're still working. A couple of fires they had to put out over the long weekend. He'll tell you they were careless disposal of smoking materials. DPW Director Chris Signoli. Trash continues to get picked up. Recycling, yard waste, sidewalk work has started. His inter-office work, engineering, administration is now expanding, and he continues to be the oversee. We're stockpiling as much as we can for PPEs and masks. We have to be ever prepared, so we'll never have to want at all. And it's terrible that the United States of America would have to plead for supplies that are desperately needed. We need to start making our own right here in the United States of America. Superintendent of Schools, Dan Warwick, he and his team have done a tremendous job. 843,000 meals have been served to our students and families, 18 sites across the city. Schools, 93,000 meals went out Friday for the long weekend. We're going to get well over 1 million meals served. This is a breakfast, lunch, dinner, and snacks, and now milk. We worked out a deal so milk is not thrown away from the milk producers through the Oasis Food Bank, John Foley, and the Food Bank of Western Massachusetts, and many of the volunteers. That's every Friday. We do that out of Central High School with the help of DPW and Commissioner Clapper with the Police Department and Principal Tad Tokars and many, many volunteers. We serve about nearly 3,500 families every Friday. I was up there a couple Fridays ago to hand out meals and give people encouragement. The Superintendent Warwick probably speak to you a little bit more. The graduation ceremonies that we're going to have, 2, and then maybe you'll speak a little more specific that summer learning will be remote. Summer learning will be remote I touched upon that a little on Thursday. And Pat Sullivan, Director of Parks and Facilities Manager at the Wizard of Oz. We had a good weekend in the parks. Good weekend in the parks because of the proactive patrols and notices we put out there. And we had a good weekend on the golf courses too. People abiding by that. He's working with all my cabinet heads on the reopening of City Hall. Again, whether phase 2 or 3, we're still determining if possible what our summer programs will or will not look like. Tim Sheehan, my Director, Chief Development Officer at GoDev, 80% of the last phase of Prime the Pump contracts, grants have been contracted. Minority-owned businesses, over 45%. We saved well over 100 jobs, keeping people working. We're continuing to be prepared we're continuing to work with our businesses, specifically our restaurants, for the outdoor al fresco dining that's being put together when they're ready to go. Another thing that is near and dear to our heart, many people are struggling to pay their rent, pay their mortgage. We got another pot of money from HUD. We're putting out an RFP for a nonprofit to help out these individuals who are struggling with their rents and mortgage relief on that. We're in the business of business, and we need to continue to dictate our future. We had a great Zoom call with the new owners, especially in the economy we're facing right now, the new owners of Sears, the whole Sears complex at Eastfield Mall, and they're very bullish on Springfield, and they're very bullish on brick and mortar and retail, so we're looking forward to working with the new ownership there. Attorney Mahoney, my HR and Labor Director, and Eddie Pakula, my City Solicitor, again, they continue to work on the opening and the entrance areas and employees training and posted from there. So being respectful of the professionals here from Bay State and Mercy, I'm going to bring them up, and questions from the media will be taken right after they both speak because they have to leave, and then we'll go into the updates directly from my cabinet heads. So today, again, and a great pinch hitter too for Dr. Mark Kerouac, who's the President and CEO of Bay State Health Systems, is Nancy Shandolf-Alec, RN. She is the President of Bay State Medical Center, Senior Vice President of Hospital Operations at Bay State Health, and I will bring Nancy up first. Very, very appreciative. She's been on some boards and stuff in Boston on the health perspective, and then we'll bring up Dr. Robert Roos, and subsequently we'll take questions for both right after that. Nancy, thank you very much for being here.
Thank you, Mayor Sarno, and thank you to the media for sharing important information for our communities. I hope everyone enjoyed their weekend, remembering and honoring our veterans, and enjoying the beautiful weather and practicing social distancing. I serve as president, as Mayor Sarno said, of Bay State Medical Center and Senior VP of Hospital Operations, which means I'm responsible for all of the Bay State Health hospitals. I am a nurse, and I am truly inspired by the teamwork, collaboration, and can-do attitude of our professionals throughout this pandemic. I am proud of our frontline staff, our doctors, nurses, respiratory therapists, and every patient-facing team member. And all of those, actually, because for us to do our jobs on the front lines, there is a whole team supporting them. Safety is and will always be our #1 priority. I am fortunate to serve on the governor's phone calls every day with 8 other Massachusetts hospital CEOs. We are planning for every aspect of this pandemic, and the governor is focused on a safe reopening and ensuring that the citizens of the Commonwealth will be well cared for should a surge emerge. I want to recognize Dr. Mark Kerouac for serving on the Governor's Reopening Advisory Board. He is the only hospital health system CEO to work on the reopening, and they just completed their work last weekend. The governor is planning a phased approach driven by data. Advancing to the next phase will require a continued downward trend of cases and assurance that we can safely care for all who need us if a surge occurs. This week, Bay State Health will attest to meeting the criteria to begin additional services. So what does attesting mean? That we have surge capacity, that we can increase our intensive care unit and medical surgical beds if needed, that we will reopen pediatric ICU and inpatient behavioral health. But I do want to say Bay State Health never closed these services. Throughout this pandemic, our pediatric intensive care unit has remained open, and all of our hospitals have kept open their behavioral health units. That we have a 14-day supply of personal protective equipment, that we meet certain public health and safety standards. So these are workforce safety, that we ensure our workers are safe by providing screening, masking, social distancing, that our patients are safe, again, that we screen them, that we can test where appropriate, and we continue to limit visitation as we are now, because every person that doesn't enter our hospitals is one that can prevent spreading the COVID virus. And that we practice strict infection control, including social distancing, signage, and cleaning practices, and that we create non-COVID care zones, which we have done. And that we have a governance structure, which we are using our incident command to make sure we meet all of these clinical capacity and safety standards. And what does this mean? That in addition to providing urgent and emergent care, we can begin high priority preventive services such as pediatric care and chronic disease management for high-risk patients. Additionally, our providers can proceed with procedures they deem urgent that cannot be delivered remotely and would lead to worsening of a patient's condition. So for our numbers, we have had 1,677 cases diagnosed since the onset. Our numbers across the system and at Bay State Medical Center continue to trend down. Our high was on April 8th with 173 patients, and now at Bay State Medical Center we have 63 positive cases with 19 in the intensive care unit. We have a total of 66 patients across all of our hospitals. This represents only 12% of our adult capacity, which means we have 88% of patients who are non-COVID, and we have closed both medical surgical and intensive care COVID care units. We are able to expand beds should the need arise. We have created COVID and non-COVID care zones. We know that there is fear about coming to the hospital. We are working diligently and have made the necessary changes to ensure your safety, and I want you all to know that you should seek care if you need it. We have made changes to scheduling and to our physical environments to ensure social distancing. We have strict protocols for cleaning and sanitizing all care areas. We are ready and able to care for you. As you know, Bay State Medical Center is the tertiary academic medical center for Western Massachusetts. We are pleased that we have 4 distinct treatment pathways for COVID-positive patients, 2 of which are actual clinical studies, part of national research trials. Remdesivir, we have 28 patients via emergency authorization. Convalescent plasma, we are treating through an expanded program through the Mayo Clinic. And then we have clinical trials on both hydroxychloroquine and a monoclonal antibody, which is over 100 patients involved in research today at Bay State Medical Center. We are also performing serologic antibody testing to see if individuals have antibodies. Now, we don't know exactly yet what this means, because if a person we don't know whether a person is infectious at the time, and we are really hopeful that in the next 6 months, many of these questions will be answered and we will be better able to manage the patients and manage the population. The goal for Bay State Health is to perform about 1,000 tests per day, and today we are testing about 500. We are using multiple platforms, and we continue to expand platforms and evaluate them so that we can meet our goals. As you know, testing remains a national issue, and our governor is committed to increasing testing dramatically and having Massachusetts as a leader in the nation. And he has applied for a federal grant. So today in the Commonwealth, we test about 10,000 patients a day. The goal is to be at about 30,000 by the fall and 50,000 per day by the end of the year. This will greatly enhance our ability to manage and to live in a new normal environment. So in addition to testing at our Bay State Health sites, Springfield, Greenfield, Westfield, and Ware, and doing the testing for Friends of the Homeless, we will be testing at foster homes beginning June 1st. Just as with testing and testing materials and reagents, we have many vendors supplying personal protective equipment. We have created a new role of PPE coaches that monitor staff putting on and off their personal protective equipment. That must be done very disciplined, with diligence, so that you do not infect yourself when you come out of a patient room. They provide real-time guidance to staff so that they are safe in caring for COVID patients. This role will be part of our future and our new normal. Bay State continues to outreach to vulnerable areas in Springfield, and we work to rally our opinion leaders to share the importance of prevention protocols. It seems like this weekend we did well. We have a team that has identified high-risk locations in Springfield, and we have initiated outreach. We have performed needs assessments, and we are working to share information that is culturally and linguistically appropriate. Every day, there are teams that demonstrate exemplary, compassionate care. In this pandemic, with restricted visitation, we are using technology to connect patients and families. We have witnessed patients perk up after using an iPad to connect with children and grandchildren because visitation is so much a part of a patient's healing. We celebrate patients well enough to go home, and we do what's called a Code Rocky, where the Rocky theme song plays and a patient with their permission receives applause and a standing ovation. We are approaching 500 Code Rockies. And this fulfills not only the patient, but it brings joy to the healthcare providers, because many of them, if you work in the ED or ICU, may not see the patient full recovery. It is also wonderful to know that 727 babies have been born since the start of the pandemic, bringing joy and new life to our community. So I want you to know, throughout Bay State Health, we are focused on safety for our patients and safety in our environments to protect all who provide care and those supporting those that provide care. We want you to know that we will be ready if there is a surge of COVID-19 patients. We are ready to care for you and your families to deliver preventive, chronic, urgent, and emergent care. Thank you very much for the opportunity.
Thank you, Nancy. Thank you, Nancy, very, very much. And we're also joined on the medical front, who's been a great partner, Patrick Leonardo, Operations Manager for AMR, not only in medical, but he's worked with us on our homeless triage medical tent. Nancy, thank you very much. I'm going to bring up Dr. Robert Roos, who's the Chief Medical Officer from Mercy Trinity Health Systems. After he speaks again to the media, because they have to leave, I don't want to keep them here longer than they have to for another engagement. They will take questions. Then I'll go into with specifics with my cabinet heads. So the Chief Medical Officer of Mercy Trinity Health, Dr. Robert Roos.
Good morning, everyone, and thank you, Mayor. Continue to be grateful and impressed with the work on behalf of your entire team. And particularly, we've highlighted some things regarding the care of the homeless. And I just continue to be impressed. 900,000 meals given out here in the city of Springfield. Some great ways in which you're continuing to care for all of the residents during this challenging time. I also hope that everyone had a very nice Memorial Day weekend and was able to enjoy some friends and family as we remember and honor the lives of those who have died serving in the United States Armed Forces. All of our veterans and our military families whose lives have also been impacted by those losses. I'm called on that day to remember all the families of those who have had either served or are currently serving in the armed forces, and I am called myself to remember my grandfather, who passed away at a relatively young age from complications of exposures he had during World War II. Somewhat ironically now, as a young major, having just graduated college, going into the mainland China to defuse undetonated bombs, having arrived there just 2 days after that fateful day at Pearl Harbor. Connecting the pandemic and Memorial Day had me thinking over the weekend of first how often we've used imagery and language of war in this fight against the pandemic. Our soldiers on the front lines, battling an invisible enemy with our protective equipment. But it's also had me thinking about the tremendous and tragic loss of the lives that have died, people that have died from COVID. As of this date, there's been over 100,000 people that have lost their lives to COVID here in the United States and 350,000 globally. So lives lost here in the United States represent about 30% of the total global impact of COVID, and 3 times as many as any other country. In Massachusetts here, we know that total is over 6,400. And so whether it's culturally appropriate to call this pandemic a war or not, there's no debating the impact of the tragedy on all of us that this virus has had, as well as the need for us to have a coordinated and civic-minded response. So at its core, I believe that COVID really presents to us a societal challenge and a calling to protect each other, to promote and preserve each other's livelihood and well-beings, and to promote public health and community solidarity. What you and I do today will impact what we can do next week and the week after. It's really that direct and consequential. This past week, we saw the beginning of phase 1 of the reopening plan here in Massachusetts, which was an encouraging sign for all of us. But we must continue to follow the science and the data, or we could risk a backslide. And so in terms of that data, in our numbers at Mercy, with safety as our top priority, we too continue to see the trend in the right direction. This morning, we had 20 cases of confirmed or suspected COVID admitted to Mercy Medical Center, and over the past week, that number has fluctuated between 15 to 20 on a daily basis, with only 6 in our intensive care unit, the lowest numbers since early days in the pandemic. We've now had 3 consecutive weeks of steady declines in the numbers of patients and the percentage of our inpatient census with confirmed or suspected COVID cases, now representing lower than 15%. We've talked a lot about how we've created COVID-free zones, entrances, walkways, elevators, and entire floors. And last week, we did indeed close another COVID unit, bringing us down to 1 outside of the intensive care unit. In regards to testing, we've now tested over 10,500 individuals with 2,409 positive tests and nearly 8,000 negative tests. Our percentage of positive tests has also declined now over 3 consecutive weeks. And we are having an average over the past week of just 10 positive tests per day at Mercy Medical Center, and about 30 when we look at all sites that we currently include for testing. We at Mercy are also planning to attest to the criteria to bring in additional procedures over the coming week, as we've also met our standards for capacity, our care safeguards, and workplace safety and infection control. We have been testing all patients that are coming in for essential procedures over the past several weeks, and we've not had any patients come in test positive. which is a sign of the effective safeguards, the value of social distancing, universal masking, and isolation if sick, and also the relatively low prevalence of virologic infection in the community. This week, we are also pleased to announce the launch of serologic antibody testing through Mercy Medical Center and Trinity Health. As you know, we've been very cautious with this. We've been wanting to ensure that the tests that we're going to use will provide as accurate results as possible, and we recognize that there are limitations to what's known about the presence or the absence of having antibodies. Yet we've also been guided by the needs of the community, and this is another example of that. We recognize that there are people that want to know if they've developed antibodies in response to a coronavirus infection. There are others for whom antibody testing may identify a prior infection when a direct viral test was not able to be performed. And there's others for whom antibody testing might be able to identify potential donors for convalescent plasma. So as we look to implement this week, we are guided by an approach of those simple principles, only using tests that have a high specificity, starting with individuals that have a medium or high prevalence of prior infection in order to minimize false positives. And so we will be starting with existing patients of Mercy and Trinity Health's medical groups and some selected colleagues on a voluntary basis. And then we look to expand that out to broader groups week over week as we perform more outreach with community agencies and potentially employers as we learn more about the tests and as we develop more in-house capacity. We recognize that as businesses and activities begin to reopen, this type of testing may be very useful to understand the penetrance of the virus in the community, as well as who may or may not, but may have immunity to a future coronavirus infection. So with that, I do want to remind everyone that we're in the early phases, the early days of phase 1. We have a long and probably winding road ahead of us, and it's with all these types of tools and tests, care safeguards, and the continued focus on physical distancing, masking, and hand hygiene, and following our data that will support us moving forward together. I will say it again, what you and I do today will impact what we are able to do a few weeks from now. But I'd highlight that we've already seen some tremendous progress as a result of those efforts. Together, we have flattened the curve. Together, we've managed to acquire the necessary PPE for all of our direct care workers. Together, we have expanded testing dramatically and outreached to at-risk communities. Together, we have developed treatments, and we are studying their effectiveness. And most importantly, together we have remained open, ready, and prepared to manage all of your essential health care needs. At Mercy, we are here for you. We provide safe care to everyone. We want you to take care of yourself. Not only will we overcome this enemy, but we will emerge stronger, more adaptable, and with more resolve. And as my grandfather would have said, this is an opportunity for us to live a life with purpose. Now is not the time to let up. Thank you.
Thank you, Dr. Roos. I'm going to bring up Madam President Nancy. Dr. Roos, if you'd stay up here also, too. They have another meeting they have to be at, and I'm so deeply appreciative, again, the friendship and the partnership with Bay State and Mercy. They will take any and all questions from the media right now, then I'll bring my cabinet heads up one at a time for their update. Paul?
Question for President Basic. What, you talk about what some of the high priority preventative procedures that you'll now be making available that weren't during the pandemic phase?
Yes, so if for example, a person has a history of breast cancer in their family, mammography by itself is considered a routine procedure. Now, if someone is late in terms of getting their annual mammography and with this history, those are the kinds of things that we will be able to begin to offer. As Dr. Roos said, this is going to be a longer road, and the purely elective will be part of phase 2.
So So would a colonoscopy, things like that, would those be included in this?
Those they will, purely preventive services will be in the next phase.
So that's the next phase.
Yes.
So you're very limited now on what you're going to be doing.
Correct. It is where there is a concern about a person's condition deteriorating. And the other thing that I would say is when this pandemic started in mid-March, we canceled all elective procedures, right? And so some people that may have been deemed elective in March that were scheduled for surgery the first, second, or third week of this pandemic are now seeing their conditions change. And I would urge any to go back to their provider, because now it may not be just elective. It may be an urgent elective or emergent case, and those we are open for as we speak.
And Dr. Bruce, is that pretty much the same situation at Mercy? And this is
It is,
starting
yeah.
this week, right?
It is. So the Commonwealth put out some pretty clear guidance regarding the types of procedures and studies that would be included once hospitals and health systems attest to the criteria. So it does relate to what Nancy had said regarding procedures that can no longer be delayed due to risk of a worsening condition. This often includes things like diagnostic studies. So if there is a symptom or an abnormal prior finding coming in for that colonoscopy or that mammogram that otherwise could present an issue, but not including routine every year or 2 year, or in the case of colonoscopies, every 10-year screening exams.
Any other questions?
You said that the person who's been doing serologic testing, and you were concerned about do you know which ones you are using? Because there's been a lot of controversy about some of the ones that have been out there.
Yeah, so there's a few, right? Currently, Mercy is going to be working with our reference laboratory, Ward Laboratories, which is part of Trinity Health nationwide, in order to conduct that testing in the early days as we work to bring on a platform in-house. I'll be able to provide some more information on that once we provide that in-house. But right now, the tests that we have, we will be using are up at the highest levels of sensitivity and specificity to ensure minimizing any potential false positives.
And with regards to regular testing for COVID, is there a statistics or data on how much of tests are performed are done in-house, like in Springfield, so it's having to be sent out somewhere to
Yeah. So I'll just speak for Mercy Medical Center and Life Laboratories. So we're performing between 300 and 400 tests per day, and we're performing nearly all of those in-house. We do have the ability, if we needed to be able to send some out to other labs like Quest or Genesis or others. But since we were able to expand, we have an in-house capacity at Mercy that can exceed 400 a day. So we've been able to manage that in-house.
And there hasn't been any materials limitations, supply limitations, you know, meet that on a day-to-day basis.
With the platform that we're currently using, no. It actually allows us to use a multi-collect specimen container that is widely available, for which there are thousands or tens of thousands available on hand currently. But with other platforms, there has been limitations, which is why we've moved to use this platform, which is on the Cepheid platform, to allow us to move those tests around as quickly as possible.
Any other questions, Audrey, Mike? Again, say again, any other questions for Dr. Roos, Madam President?
Thank you.
Thank you so much
Thank you.
for what you and your team continue to do for each and every one of us in the city of Springfield and Western Mass. And good health to you and your families and your team.
Thank you,
so
Mayor.
much.
Thank you
Yes,
for your
Nancy.
leadership.
Thank you.
Thank you. Let's give them a round of applause. Their whole teams. Okay, now we'll go into an update from my cabinet heads. And Commissioner of Health and Human Services, Helen Carlton Harris, who has done yeoman work being my and the city's point person, will now come up and give her update. Another stylish dress she has on today. Okay. Tell us. And nice shoes, too.
Thank you, Mayor Sarno. It's always a pleasure to hear your comments on my shoes. I am appreciative. I want to first of all start out by thanking those individuals, those women who I am a life member of the Ladies Auxiliary of the VFW. And I want to thank, as I recognize Memorial Day, those women who have over the years been extremely supportive to our veterans and who have taken on various roles over the years in supporting not only our veterans but their families. Thank you to the community-based organizations who have reached out to me to tell me about your Beyond the Walls of City Hall activities. I am appreciative. The staff of the Department of Health and Human Services, thank you for what you do every day. And of course, Bay State and Mercy. Thank you to Jason Mann, who does the map for me once a week. I am appreciative of his support. And those members I am so impressed with and work with on a daily basis, the members of the Mayor's Cabinet. Thank you. Thank you to Mayor Sarno for his leadership and being vigilant about every aspect of this coronavirus pandemic. As the mayor said, in the Commonwealth, there are 93,271 total cases. In Hampden County, 5,755. The city of Springfield, 2,261. That number is 39.3% of the total cases in Hampden County. When we look at our cases in the city of Springfield, we certainly recognize that long-term care facilities account for a good deal of our cases. We are also recognizing that our frontline workers in healthcare and other businesses are also accounting for our positive cases. The deaths in the Commonwealth, 6,416. 3,924 of those are in long-term care facilities. In Hampden County, that number is 543, and the city of Springfield, as the mayor indicated, is 92. Statewide, deaths in long-term care facilities is 61%. Here in the city of Springfield, it's 52.1%. The residential addresses account for 47.8%, and this is our death data, as the mayor indicated, as of May 20th. 50% are white, 20.6% are black, 28.2% are Hispanic, and 1 Asian, which is about 1%. Springfield has 92 deaths. It's important to stop and recognize that while we say the data, there are individuals who account for those 92 individuals. Statewide, the average of positive tests are 52. 68 is the average hospitalizations, the age 68, and 82 is the average of deaths. It's important that we stop and think about what that really means. Think about someone you know that is 52. Think about someone you know who is 68, and think about someone you know who is 82. It doesn't matter how old an individual is, their death leaves a gap in our family fabric. I have heard from many of you who have told me the stories of your loved ones who have passed from this virus. I would appreciate it if we were able to publish some of those stories on the city's website. So if you are willing to share information about someone you know, you love, and you lost through this COVID-19 pandemic, please let us know by getting in touch with me at my department. It's important that we put a face to this virus and not just look at the fact that it's a number, a face and a story. Harm reduction in the age of coronavirus. Harm reduction really is about risk mitigation. Individuals are going to take risks, but we ask you to think about the harm that you're doing to your friends and your family by not adhering to the guidance. We cannot ignore the death, the mental and physical devastation we are all experiencing. As we begin to open and resume portions of our life during phase 1 of our recovery, our behavior during phase 1 will be a predictor of how we go into phase 2. The map in front of you, when we started doing it on April 6th, we had 171 locations in the city of Springfield. Today, there are 1,384 locations all across the city. We are still seeing the clusters in the zip codes that I've talked about, but our main cluster is 01104, where we have a long-term care facility that is showing positive results at a higher rate. Contact tracing. I want to just spend a moment talking about contact tracing because that is one of the very important legs of our stool. I would appreciate it so much if you receive a call from a contact tracer that you are answering that call. Every day, the Department of Health and Human Services gets data pushed back to us around households in our city who are not responding to individuals who are calling about contact tracing. It's very important. If we are going to mitigate this virus, we need your cooperation. If you receive that call, please adhere to the guidance that's given to you, isolate if you must, and quarantine if you must. Many of the cases that are coming back to us are cases that we have given to the state. We keep many of them, particularly our healthcare workers and frontline workers, but we're getting many of them back. Please answer the call. Testing sites has been noted. It is my understanding still that testing sites need to have a physician's note. We are not doing asymptomatic testing at this point, although testing is expanding. Testing is going to be so important to our reopening this country and this state. We need to understand the penetration of this virus, and we can only understand that by understanding where the community spread is happening. Community spread is a spread when you do not know that an individual is positive, yet they can spread it to other persons. One more important fact, during this time, we cannot be powerless spectators. We have to be powerful initiators. When you visit businesses that are open during phase 1 and begin to venture into them, remember to adhere to the guidelines and also remember about not being powerless. If you are in a barbershop, a hair salon, and you recognize that there are not the protocols or guidelines put in place, please say something. Use your voice to say and ask questions about behaviors and risk factors. That's going to be important. Our risk communication strategy has to be in place. We have to understand that we are going to take risks at what we do as a society. So the social distancing, stay home if you're sick, cover your nose and mouth, and make sure that you are having patience. It is a time for us to be patient with each other to the degree that we can. Again, I want to thank Bay State Mercy, Springfield Public School nurses, Jason Mann, the residents of this city who call the hotline every day to report those things that you're seeing out there. We take them seriously, we follow up, and it's important that you continue to let us know. Finally, the human toll I spoke about. But again, I would very much appreciate if we were all able to work together to highlight some of those individuals in our community who we have lost. The mothers, the fathers, the grandmothers, those individuals who were with us on our life journey. And so remember that this pandemic is not over. And because we are going into this phase one, it's important for everybody to recognize this is phase one. It's going to be rocky. There's going to be some steps that we have not anticipated. Again, please be patient. We will get through this together. Thank you.
I'll get it. Don't worry. Thank you, Commissioner Helen Colton Harris. And you mentioned about hairstylists and barbers. So tonight, I'll finally be able to get a trim, an appointment to get a haircut on that. So, but we have to be patient. And if you do see operations that are not functioning properly, we need to know that so we can educate the residents and business community of the city of Springfield. We're all anxious to reopen. And again, City Hall will be reopening tomorrow appointment basis, and we're working as soon as the governor that go ahead in phase two with the other businesses, we'll work hand in hand with those businesses. Just like a chess match, we have put together a plan. All the things we've done to reduce the spread of the community mitigation, the spread of it, and partnering with our hospitals. So if and when, and I'm knocking on wood, if and when a spike is to occur, Bay State and Mercy can handle it, if and when. In the meantime, we need to continue. I know it's common sense, seems common sense or basic, but wear those masks when you're out and about. The social distancing, physical distancing is important. Wash your hands constantly. If you don't feel good, stay home. That's extremely important. And the last thing I'll say before I bring up the public safety component of this press conference is that one word, confidence. And we're continuing to move toward building public confidence, business confidence, and consumer confidence. And that is done through our plan, and also, as Commissioner Helen Colton Harris mentioning, the more and more testing we can do, the more and more contact tracing we can do, the more that we'll be able to stay on top of if a hot spot occurs. But all working together. And again, I thank the residents and the business community of Springfield. You've been fantastic. And I need you to hang in a little more longer, because we will defeat this COVID-19 and coronavirus. The public safety component, again, the brave and dedicated men and women in blue are out there day in and day out, not only having to deal with the pandemic, but the regular challenges of policing in America. And the firefighters, same thing. They're out there day in and day out. I think they had 2 or 3 fires they had to knock down this weekend, long weekend. I think 2 due to careless disposal of smoking materials. So with that, I'm going to bring up the Police Commissioner of the City of Springfield, Cheryl Clapper.
Thank you, Mayor. Good morning. Pleased to report that we're down just six officers because of COVID. We have a pretty good workforce going for us right now, so we were able to use many of the patrols over the weekend to help out. I think that helped keep things pretty much in order. We were out on bicycles, walking, and motorcycles, along with regular patrol, so with the assistance of Parks Department employees under Pat Sullivan, and I think it was a very good weekend for those who wanted to walk around Forest Park or any other parks in the city. The weekend was very manageable. I will say that we had made a lot of strides with C3 and community policing before this epidemic, and obviously now with the distancing and the masks, it's getting very difficult to keep our relationship going. So the C3 officers getting a little antsy asked if they could participate in some food drives. We did that. They had a Mason Square food drive Saturday at the Freedom House of God on Union Street, and we will continue to do some more of those for the neighbors that we see that are in need. We help on Fridays along with DPW and everyone else at Central High School at that food giveaway. And Captain Kane, who is in charge of midnight to 8, said that that's my younger officers on midnights to 8. They wanted to do something, so we have agreed every day we put boxes in front of the station, and you can drop off non-perishable food items there. And Squad A, the midnight to 8 officers, would like to give them out to people they meet and see in need during this time. So I will also say that as far as obeying the mask orders, I thank everybody and their cooperation. We have not had to issue a violation for not wearing the mask, and we have handed out several of the surgical masks if you need them, and I thank G-Tech for that donation of 400. Thank you, Mayor.
Thank you, Commissioner. Thank you, Commissioner Clapperud. And now the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi. Commissioner Calvi?
Good morning, Mayor. Thank you. Good morning, everybody. As the Mayor stated, we had several fires over the weekend. A couple of them were attributed to careless disposal of smoking materials or smoking. I've reminded people before about this with being at home with the quarantine and everybody being inside. Everybody needs to be very careful with that. The next thing I'm going to talk about is we've had several, actually I'll use the word numerous calls over the weekend for illegal burning, outside burning, or brush fires. Outside burning in the city of Springfield is illegal. You cannot be burning outside your residence. You can't have campfires outside your residence. Outside cooking is permitted, but as soon as you're done cooking, you have to put the fire out. We've received calls for smoke in the area, which have turned out to be outside campfires, cooking fires, people just sitting outside burning a chimenea. I know people like to do that, and it's a lot of good times can be had doing that type of thing, but in the city of Springfield, that is illegal due to the density of the population. So please, no outside fires. At the fire department, we have 3 people out with COVID-type symptoms. They're awaiting testing. Our other employees who have tested positive are back to work, so we're in good shape personnel-wise at the fire department. We're keeping things going, responding to calls every day, and out there as much as we can in the community. So thank you everybody, and have a great week.
Thank you, Commissioner Calvi. Thank you, Commissioner Calvi. We'll now move to schools, and Superintendent Dan Warwick and his team have done a tremendous job in these challenging times. So Superintendent will give you some updates. Superintendent Dan Warwick, Springfield Public Schools.
Thank you, Mayor. Good morning. This weekend on Friday, we distributed 93,736 meals. So we took care of families for Friday, Saturday, Sunday, and Monday, taking us up to 843,304 meals since this pandemic began. Before school formally closes on June 19th, we'll have distributed over 1 million meals to families throughout the city. We have spent a lot of time planning, and for the summer we have decided we can do more for more families with remote learning. We're going to offer all of our traditional summer programs remotely And we're going to create an enrichment program for families to do special projects and some fun project-based learning activities for everyone in the city to try to, again, make up for some of the remote learning that occurred this spring. We're planning graduations for our seniors and really working hard on that. First 2 weeks of June, according to our normal schedule, our 8 high schools will graduate their seniors. We're going to have a presentation, a virtual presentation on Channel 15, Focus Springfield, and have a remote graduation for all 8 of the high schools. In addition, and credit goes out to our high school principals and their staffs, they wanted to create an in-person experience that was safe but memorable for our families. You know, I think that senior year, we have to remember how important the rites of passage are. So they're creating an opportunity for the families to come in one at a time and get an experience on stage, get some pictures in their caps and gowns, so they'll have some of the traditional pieces of a graduation ceremony. Again, I think I really want to credit my staff. It's been a tremendous effort on part of my entire staff. Our teachers, counselors, administrators have been reaching out to families to get them involved in the remote learning. We distributed over 17,000 laptops throughout this city. Again, I'd like to thank Mayor Sarno for his support in expanding our capacity with the laptops so that learning can go on for our students. And our staff has been really out there trying to reach out and meet family needs, right down to even counseling needs for families that are having some issues. For any family who needs support in the area of remote learning or with counseling issues, our principals are available at the schools, and just give them a call and they'll follow through with staff to support our family needs. Thank you, Mayor.
Thank you, Superintendent Warwick. And to a man who wears many, many hats, facilities management, the parks, he's helped on homelessness, Pat Sullivan, who's the Director of Facilities and Parks, the Wizard of Oz. Mr. Sullivan?
Thank you, Mayor. As the Mayor has indicated, some events and buildings are reopening to the public as starting tomorrow, and these are resuming under the guidance provided by the Commonwealth of Mass following CDC guidelines that provide the steps required to ensure the safety of park patrons and our Springfield residents. So buildings will begin receiving visitors for our residents and to do city business starting tomorrow. You will need to make an appointment prior to coming to any city building. Parks continue to be open for passive recreation. The Farmers Market in Forest Park opens today with strict guidelines. The zoo will open once again once we have the bath attendants hired to man our bathrooms in the park. Our golf courses remain open. The carts are now available for one person to rent, and the mayor has moved forward hiring bath attendants to try to get those open by the end of this week as well. Tennis courts open today in the city of Springfield. They are under strict guidelines, only 2 players per court, no double matches. And the park concessions open this weekend at both Forest Park and the golf courses. This week I will be working with our health commissioner, the mayor, and the rest of the cabinet in determining phase 2 and 3 openings, and we look forward to sharing that with everyone within the next week. Thank you.
Thank you, Pat. Thank you, Director Sullivan. Thank you for your facilities management team, the physical plant changes they have done, whether throughout City Hall or throughout many of our municipal buildings, to make sure that residents and business community are not only protected, but we continue to preserve and protect our workforce, our employees here. And again, DPW, you know, your trash is getting picked up, your recycling is getting picked up, your yard waste is getting picked up. So those men and women are out there daily, and when you see them, give them a thumbs up, give them honk the horn, give them a wave. Unsung heroes. So with that I'll bring up Director Chris Signoli. Director Signoli.
Good morning, everybody. With regard to DPW, we have 2 employees out that have family members who have tested positive with COVID. We have 2 employees that are out that are awaiting testing and/or results. Starting, as Pat was talking about, starting this week, we're going to start to get back to normal up at Tapley Street with regard to visitors. As usual, most of the items within DPW are a call to 311. So if you have any issues with regard to trash, recycling, potholes of that nature, get in touch with 311. Our construction activities within DPW stepped up last week. We started to get back, starting to do sidewalks, starting to do in-road repairs that were needed. Administration and engineering offices inside DPW had been on a 1 day on, 2 day off. As of today, we are back to a 1 day on, 1 day off, working remotely but back in the office, knowing that activities will start to pick up with regard to the public. With regard to trash and recycling, there were some, trash specifically, there were some issues at the burn plant last week that backed up a lot of our activities, that extended some of the days. That may extend into this week a little bit. All trash will be picked up on the day that you have it out. It just may be later. So if it ends up getting too late, please call 311 and we'll be able to tell you if there are any issues, but it should be able to continue without a problem this week. And that is it with regard to DPW.
Thank you, Director Scanelli. Chris, thank you. Again, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team have done a tremendous job in this new age of normalcy to try to keep our existing businesses going, and we continue to cultivate to bring new businesses going. But Director Tim Sheen will give you an update. Tim?
Thank you, Mayor. We wanted to continue to report on the Prime the Pump program. At this point, we've contracted 80% of the awardees. 45% are minority, women or minority, or women-owned businesses. That relates to 17% minority-owned, 8% women-owned, and 20% minority women-owned. The current employment base for the awardees in total is 657 employees, of which 443 are residents of the city of Springfield, over 300 of which are low to moderate income individuals, and we have assisted in retaining approximately 1/3 of that workforce through the Prime the Pump program. As the mayor indicated, we continue to work with the restaurant community that has been so impacted by the emergency orders to try and figure out how best the city can support them as they emerge back into business with certainly a much more restrictive floor area in their operations and looking at outdoor dining opportunities. The city will be seeking to work with a nonprofit housing provider to administer a mortgage and rental assistance program of approximately $2 million. We should be making that announcement in terms of who that provider will be in the upcoming days. What we're really concerned about, there's currently a moratorium on housing court actions, but ultimately, we want to ensure that no resident of the city of Springfield ultimately ends up losing their existing housing based on a virus-related issue and or an employment or unemployment situation. Thank you, Mayor.
Thank you, Director Sheehan. I don't know if on the legal end, Solicitor Pakula or Attorney Mahoney, HR Labor, have anything all set. And again, the financial update I gave earlier for CAFO TJ Plant. With that, I will open it up to any and all questions, whether of my cabinet heads or myself. And again, I want to thank the media so much, TV media, print media, radio media, for being very steadfast in getting out the information and communication to Springfield residents and our business community. So, any questions at all? Matt, go ahead.
This is not really what you mentioned earlier on about Sears property. Did they give any indication whether they were using the building or demolishing it?
Not detail, but what we were happy to hear about, and Director Sheehan might want to compliment, they're big on the brick and mortar, and they were big on reviving retail. But I think the big message that was sent here was that they're bullish on Springfield, even because before the time of this pandemic, we were moving forward positively, especially on all fronts, but especially on the economic development front. Now, there's a new normalcy now, but that Zoom meeting, Tim, why don't you come on up? We were very about the brick and mortar and about the redefining, reinvigorating retail. But Tim, go ahead.
The new owner, they are a retail-driven firm, and they, as the mayor indicated, they still remain very confident that the site should have a retail-related use. We are very encouraged by that. In terms of the answer to your question, they had just closed on the property, and they don't have a specific plan to point to, but clearly they want to get engaged in that work very soon and be working with the city on it.
Is there like a goal as to like the percentage of money that would actually go into the hands of people that would be paying their mortgage or rent as opposed to a percentage of whatever the nonprofit would be taking for their
Yeah, we would cap a percentage relative to the administration component of that funding. Ultimately, we have to select the nonprofit entity, but the funding at this point is available. It's just a matter of working through the logistics. And as I indicated, there's a moratorium on the housing court activities that gives us a little bit of breathing room in order to get up and operational. But I think the important issue is that we need to have this program up and operating sooner than later. We're looking at the most effective and quickest way to implement that HUD would allow.
Again, that's $2 million, and the HUD requirements obviously will be capped on any type of administrative fees, and it'll be a reputable nonprofit that's well-versed in doing it. But that's something that Tim and I had in our mind, not our back of our mind, front of the mind, as we're putting together these chess pieces together here about the people struggling, no fault of their own, not able to pay their mortgage or pay their rent. So we'll try to get that out ASAP. Any other questions of my cabinet heads and myself? Sure. Commissioner Colton here.
You mentioned that you'd like to put profiles of some of the people that victims of COVID on the city's website. Is that something that can you talk a little bit more about that, the plans are for that? If someone's interested in sharing the story, how can they go about it?
So yes, what we'd like to do again, I have heard from residents who are telling me stories about their loved ones. And so what we'd like to do is be able to share some of those stories and put them up on the city's website. And that can be done by calling 413-787-6741 and asking for Helen Carlton Harris. I will specifically take those stories myself, talk to the individuals just so we're clear about what information the resident is comfortable sharing.
The data that you talked about earlier, the estimated race breakdowns, when you look at the state's figures, there's a big 40% unknown. But how are you able to get clean data for Springfield when there is gaps in the statewide counts?
There is the potential that Springfield's numbers could increase based on the unknowns at the state level, But the Department of Health and Human Services gets the burial permits, and so all of the data comes into our offices, and my staff gives me the data, and it is broken out by name, by residence, by age, and so we don't have the complete age breakdown. I'll be sharing that at our next update. I will also overlay this map with blue dots that will show where the deaths are in the city of Springfield. That is not confidential information. Death certificates are public.
So the information that the state's releasing is based solely on the reporting from the Department of Public Health, whereas your department is going, as you said, you looked at the complete records and
That's correct. And there could be unknowns again, but what the 92 that we are referencing is assuredly what we know from getting the burial permits for death certificates.
Earlier, there was a breakdown between nursing homes and residential as far as deaths are concerned. Does residential also mean people that might have died at a hospital but weren't in nursing home before they went to the hospital?
The residential address is the address that is on the burial permit. I have not seen any addresses that were specific to hospitals, so I'm going to assume that the hospitals are using the residential address of the individual who is deceased.
So when we determine who is a long-term care person, that's because their address on their burial permit said the long-term care facility.
That's correct. It has the address of the long-term care facility, and we're able to pull that data out of the spreadsheet.
And as far as the reopening is concerned, it does appear that the city of Springfield is more or less following what the state is doing. Unlike some communities, there isn't like an additional restrictions being put down. But what would it take for you to say the city might need to pull back or slow down on something relative to the state, even if the state itself doesn't deem it necessary for the entire country?
I think there are going to be two factors. One is increase of hospitalizations and individuals going into hospitals. We heard our hospitals say that they have capacity, so if you see a spike in the hospitalizations. The other factor is if you see a substantial spike in cases and are looking at clusters in the city that we have to respond to. And so I think those are two factors that really will have us talk about, do we pause? How do we put those mitigation strategies in place in order to combat that? I am hopeful, and I know the mayor and the businesses are, that we will not get to that point where we're needing to push back. And so that's why we're asking everyone to assess the risk and do what needs to be done in order to help us move forward and not move backwards.
Thanks. Any other questions of Mr. Helen? Any other questions, again, of my cabinet heads or myself?
Question for Superintendent.
Sure. Danny, Superintendent Warren?
Just to get a sense of like what would be the normal size or percentage of the student population would be going to summer school anyways, to kind of get a sense of like what the impact of there not being any live summer school would be.
We've increased it every year, but I'd say an estimate would be somewhere around 5,000 students being served somehow through summer school.
In person?
We always do some remote and a lot in person. This year it'll be all remote, but we're actually going to serve more students.
And what's the student population?
26,000.
So substantially fewer students participate in the summer program than
Sure, yeah. We have specific programs to meet certain needs, but it's always a lot fewer than our general student population.
And do you imagine this summer program to be primarily geared toward what it would traditionally be for a summer program, or is there going to be more of an emphasis on trying to make up for some of the digital that's required? There was sort of a little recently about concerns about digital dropouts, so to speak, or virtual dropouts, I should say.
Sure. Sure. So we're doing both. We're offering all our traditional programs. So, for example, at high school, we always have course recovery for students who failed a particular course. All of those are going to be offered, albeit online this summer. But then we offer some other programs for enrichment and things like that, or for support in certain grade levels, like the grades moving on, like the 5th graders, 8th graders moving on to the next level. Again, we're going to offer all those programs, but in addition, my academic team is planning an enrichment program citywide to offer some reading and math activities, but then offer some nice project-based activities for students and their families to engage in. Again, because of the transition to remote, there was some learning loss there, so we thought keeping people engaged. So all the laptops we've distributed, we've decided to leave them out there for the summer so that students and families can all engage during the summer.
Not to get too far ahead of ourselves, but late August will be coming up quick.
Yes, it will.
The mayor alluded to this on Thursday, that if you go back in the buildings, there may have to be some physical changes, maybe continue to look at what physically has to be done to prepare the buildings if we go back into the fall.
Sure, absolutely. I mean, obviously, the mayor said this very well. The decision to close was a very hard decision, but the planning around reopening is going to require a tremendous amount of effort. We have a team working on that already, and I'm meeting with a team of superintendents across the state that are brainstorming these possible situations with the commissioner. But there's going to be a lot involved in that. Looking at our buildings weren't built for social distancing, so that's a problem. So we're going to have to look at that, using maybe some kind of phased-in approach when we can go back live, because certainly we're not going to be able to have 20 to 25 students in a classroom. A bigger problem is the buses. You know, we put 60, 65 students on a bus. You could probably maybe put 12 to 15 safely. So how do we get our students to and from school? And we triple tier the buses already. So, you know, there's some significant logistical issues to work out with reopening schools. So we're taking a look at all that. We're taking advantage of the teams that have been formed across the state and sharing ideas with the commissioner. But we've begun to look at these issues, and we're going to take a good scientific look at what we can do and when is the right time to do that, and make our plans in conjunction with the other communities across the state. Great question.
Any other questions?
Thank you.
Yeah, Paul, you got to remember, I think I brought it up Thursday too, is that, you know, we're doing temperature checks at all our buildings, and that'll go for student body and teachers and administration. So on the student end, where is that done? It's all being looked at. Is it done prior to them boarding the bus? Or is it done when they get to school? But then if they're not feeling well, how do you get them back home? So these are all the things. I saw some reports on national news in the country, other countries, about the social distancing or physical distancing, and Superintendent Warwick was hit it right in the head. You're talking of classes of maybe 12. You were talking capacity of the buses were 78. They were marked 12 on it. Now our goal is, obviously we want to get back to the sense of normalcy ASAP, whether in the public sector or in the private sector. I mean, that's my goal. That's our goal here. But we want to do it, as Helen indicated, in a smart way. You know, we'll base it on the public health, medical, the sciences, and we prepared ourselves if a spike was to occur, that we can handle it. You got to be able to identify it, isolate it first, and see if you can control it, keep going forward. If you can't, then you got to take a step back. But I mean, I do think that there is light at the end of the tunnel. The bar graphs that Jason Mann with Commissioner Helen Harris does, you'll see what Billy Baker puts out. We're starting now to trend more in the 20s. But I think until there's a vaccine, you'll never get back to complete normalcy. It'll be a new normalcy. But you know, we're balancing that, and things have to get going. done in a safe public health way. Any other questions or comments? Again, I am really deeply appreciative of the media, the TV media, the print media, and the radio media for faithfully being here, getting out anything that we put out to the residents of the city of Springfield and the business community, and really Western Mass. And I'm very thankful again to the residents and business community of the city of Springfield. You've been great. You've been great. We've asked you to do many, many things, and you continue to do them. And that's important. You're all frontline heroes to an extent, because you're helping to stop the spread as we move to starve and kill this virus. So we're trending in the right direction. There is light at the end of the tunnel, as Helen indicates to you and Dr. Roos or Madam President Nancy Shadell Falick on it, about the simple things of washing your hands, wearing the masks when you're out there in public, the social, physical distancing, and if you don't feel good, stay home. City Hall will be open, specific city buildings will be open via appointment starting tomorrow. Be prepared to make sure that you have to wear a mask. Your temperature will be taken. Physical plan of, if not all, the majority of the buildings has been changed with the directionals of which way you can go, which way you can't go. You're going to go in the building offices, which now you'll see plexiglass, you'll see a lot of masks, you'll see face shields, you'll see gloves, but we're anxious to see you. We're anxious to see you, and your patience and understanding is deeply appreciated. If nothing should arise, whether as a challenge, which I hope not, or something positive arises, where we have to call the press conference, we will see you all again next Monday, which I believe is June 1st, which will be the 9th, marking of the 9th anniversary or memorial of the EF3 tornado of June 1st, 2011, my mom's birthday too, God rest her soul. And that same week, we will mark the heroic efforts of Officer Ambrose, Kevin, who 8 years ago saved a mom and child from someone that was looking to kill them. So it'll be a memorable week in a sort of a sad way, but in a respectful way. And for the tornado, as I've always done, I will ask the houses of worship, if you have bells, to please chime your bells. And then a moment of reflection and silence at that exact time when the tornado hit, which I believe was 4:38 on that. And then we will, Commissioner Clapper and I will a proper memorial for Officer Kevin Ambrose on June 4th. But in the meantime, let's keep doing what we're doing, because we are getting there. And good health to everybody, and God bless. And you can go back to your houses of worship, whether it's synagogue, mosque, or church. I'll be this Saturday 4 o'clock Mass at Mount Carmel to hear the wisdom from Father White. So we're getting there. Stay well, and God bless. Thank you very much.